to talk to you guys today about headaches and how physical therapy can help headaches. According to the National Headache Foundation, more than 45 million Americans suffer from chronic recurring headaches. Most people deal with headaches unnecessarily without treatment that can help. What causes the pain? The dog? The kids? If those are the causes of your pain, I'm not so sure I can help you. But what really causes the pain are things like stress, allergies, caffeine or alcohol withdrawal, and sleep disorders. We're also going to talk primarily about headaches that are musculoskeletal in nature, and those can often be treated successfully with physical therapy. The most common types of headaches are migraine headaches. Migraine headaches often present as throbbing, incapacitating pain, most commonly found in the second and third decades of life, more common in females, and often have a familial tendency. Cluster headaches are severe unilateral headaches, most commonly found in men in the second to third decade of life. And then cervicogenic or musculoskeletal headaches, they can affect any age and either gender, but are slightly more common in females. In this presentation, I'll be focusing primarily on cervicogenic headaches. Cervicogenic headaches are often caused by postural dysfunction. We're going to talk about that quite a bit today. Because of chronic poor postural habits during certain parts of our life and things that we do repetitively, soft tissues or muscles of the neck and shoulders can become shortened, weakened, overstretched, or overworked. And we're going to talk about how that affects your body and why it can be the cause for headaches. Oftentimes, the diagnosis of cervicogenic headaches is made by the exclusion of other types of headaches. But the International Headache Society has developed clinical criteria for the diagnosis of cervicogenic headaches. Those include pain localized to the neck and occipital region and may project to the forehead, the orbital region around the eyes, the temples, and the ears. The pain is often precipitated or aggravated by specific neck positions or movements. And one of the following situations must be present. There's either resistance to or limitation of passive neck movements. So when the physical therapist does your evaluation, they would take you through some passive range of motion, and they would assess the mobility and determine how normal or lacking normal that is. And they would sense a resistance or limitation to that movement in a certain direction. The cervicogenic headaches often result in changes in neck muscle contour, texture or tone of the muscles, or response to active and passive stretching or contraction. And those are things that would also be assessed by the physical therapist. And I'm going to talk to you toward the end about what the physical therapy evaluation and treatment will look like. There's also often abnormal tenderness of the neck muscles. There are radiological exam findings as well, but I'm not going to go into that today. A lot of people wonder how their posture might affect things. The picture in the middle is normal posture. We think about the ears being lined up directly over the shoulders, which are over the hips, the knees, and the ankles. And you can see lots of variations there of different postures, and maybe you can identify yourself in any one of those. But you can see with the altered postures, you can imagine the increased stress to the tissues in your spine and the muscles that support you. Does anyone have a guess on how much the human head weighs? Nobody? 5 pounds. 10 to 12 pounds. Okay? You can imagine how hard the muscles of your neck have to work if your head is not balanced directly over your spine where it is meant to be. For the little muscles in your neck to have to hold 10 pounds all day long while you're active doing your normal activities puts a lot of load on those tissues. I need a volunteer to come up here for just a minute. Can anyone help me out? I'm going to pick on someone if you know. All right, Mary, come on. I'd like you to hold on to this for me. Just keep your elbow bent about that far. This is 10 pounds. We're going to see how Mary feels in a few minutes. Forward head posture. For every inch of forward head posture, so the head being forward of the tip of the shoulder, the increased weight of the head on the spine is an additional 10 pounds. So in this example, the person's head is about 3 inches forward of the normal position. That increases the weight of the head on the neck by about 30 pounds, and the pressure put on the neck muscles increases 6 times. I think you could all imagine that that right there is enough to cause a headache. How's your bicep?
Doing all right. Hanging in there. I'm not shaking yet.
All right.
Well, not much.
Forward head posture causes contracture of the anterior or front muscles in the neck. And this is a diagram of some of those muscles, including the scalenes, the pectoralis muscles, so the chest muscles are often involved in people with headaches, and the sternocleidomastoid, which is the bigger muscle here on the side of your neck. Getting tired yet?
A little bit.
All right. So it really took Mary only a few minutes for her bicep muscle, which is a lot bigger than some of the muscles in your neck, to get fatigued. So that shows pretty well right there.
I was cheating a little tiny bit.
Or
I
you're
had my
stabilizing.
elbow right
Cheating. In the physical therapy evaluation, we would also take a look at the postural muscles, the muscles in the back of the neck and upper back, the middle and lower trapezius muscles, which are here, the middle and lower trapezius muscles, and the rhomboids, which come off the shoulder blades into the center of the spine, become weak and inefficient at holding the skeleton up against gravity. These aggravated soft tissues can also refer pain to the head. Musculoskeletal tissues that can cause headaches include some of the muscles we've talked about, but also some of the very top joints in the spine. So this is a model of the spine. Especially the first 3 cervical segments at the top of the spine, if they're lacking mobility or have incorrect balance and mobility in different directions, can cause pain to be referred to the head, as well as the temporomandibular joint, or the TMJ joint. You may have heard that term, where your jaw attaches to the rest of your skull. The cervical or neck muscles and the postural stabilizing muscles, which we've already talked about. And tightness or restriction in the fascial tissues of the head and neck. And the fascia is a thin membrane or layer of tissue that sits beneath the skin and kind of surrounds or envelops the muscles. And if there's pulling on the fascia, it can pull at some of the structures at the base of the skull, which is commonly the location of a cervicogenic headache. In a study published in Modern Manual Therapy in 1994, 30 patients with headaches and 30 control subjects were studied with regards to posture and musculoskeletal biomechanical changes. And in that study, Watson found pretty much the things we've been talking about. The headache patients were consistently found to have the increased forward head posture, the decreased joint mobility at those top segments, decreased strength in the deep flexor muscles of the neck, tightness in the upper cervical extensor muscles and the pectoralis muscles, and weakness in the middle and lower trapezius muscles, while the asymptomatic subjects did not show those findings. How can physical therapy help the situation? Physical therapy offers a wide range of options for patients who wish to treat headaches without medicine or with less medicine. And oftentimes we see patients who come in stating, right now I'm taking a lot of medication and my primary goal is to be able to get off of that medicine or decrease it. A lot of people don't like taking medication, and I think physical therapy is a great option to help people decrease the need for the medication. Physical therapy will focus on correcting the postural dysfunctions and eliminating the pain and headaches. The physical therapy evaluation will include an interview. The physical therapist will talk to you at length about your symptoms, how they present, what kinds of patterns they tend to follow, what you've noticed as aggravating and easing factors, and then they're going to move into an assessment of your posture, range of motion, and strength. Primarily, they're going to be looking at the upper body because that's typically the driving force behind the headaches. But they're certainly going to look at the aspects of total body alignment. As you saw in that postural example, the postural changes can take place all the way down the spine, even all the way down to the feet. You know, if the feet have an awkward posture or a turned-in posture, it can change the position of the hips, and that in turn can change the position of the pelvis and the low back and all the way work its way up to the neck. So we're going to look at the whole body and see how that affects the alignment of your spine and the stress on the tissues. And then we'll go into a thorough explanation of the biomechanical findings and what we've determined as the appropriate treatment program to fit your needs. Physical therapy treatment could include things such as modalities like heat, ice, and electric stimulation, which are primarily pain control modalities used to help decrease irritability in the tissues and just give you relief in the short term to help you feel better while we're working on fixing the biomechanical changes, which are more likely the root of the problem. Manual therapy techniques such as massage and joint mobilization will be used to improve mobility and normalize movement patterns. Lots of times over months or years of having headaches, we develop movement patterns that are abnormal, which kind of starts to cause a snowball effect. We have pain, so we move in a way to avoid the pain, and we develop movement patterns that stress the tissues more, which causes more pain, so we move in a way to avoid the pain, and we're trying to help break that cycle so that the pain cycle does not continue. And then we'll help to develop an exercise program aimed at improving strength and flexibility specific to the biomechanical changes that we've noted with you. Bad posture. We all do it. I just saw some of you sit up a little taller. Besides the specific stretching and strengthening exercises you will be taught, we'll also be working with you on education, on postural principles, and how to re-educate your body on maintaining proper posture. It's really easy for someone to say, yeah, I know I have bad posture, I have to sit up straight. But as soon as you start thinking about something else, you're not thinking about sitting up straight anymore. And it's interesting, our muscles go through 4 phases as we're kind of unlearning bad habits and relearning good habits. First, our muscles are unconsciously incompetent. They don't know they're not doing the right thing because they don't know what they're supposed to be doing. That's usually how patients present to physical therapy. Then they become consciously incompetent because we're so nice that we call your attention to the inadequacies of your muscles and we tell you what they're not doing and what they should be doing. At that point, you become consciously competent. You can fix it if you're thinking about it. You know what proper posture and movement patterns are, but as soon as you go back to attending to your job or your dishes or your kids, you can't focus on both because the muscles haven't developed the muscle memory and the strength and the flexibility to be able to do it without your conscious awareness. The ultimate goal is to have the muscles be unconsciously competent. The muscles do what they need to do to hold you in proper alignment and to take you through proper movement patterns without you having to be aware or thinking about it. And that would be the ultimate goal, getting your muscles to that point so that all of your postures and positions and movements during the day were in a manner that did not overly stress the tissues in your neck. Postural retraining, as I said, will focus on the stretching of the shortened muscle groups and increasing the strength and endurance of the weak ones while we're working through those 4 phases of making your muscles become more competent about moving you in proper movement patterns. So the underlying message is that if you or someone you know is suffering from headaches, they should be evaluated by healthcare professionals so we can determine whether or not they're musculoskeletal or cervicogenic in nature. And if they are, there certainly are a large number of things that a physical therapist can do to change the course of your headache history. I think I agree with that. You may be too old to ever have the joint mobility of a teenager, but you're never too old to relearn movement patterns to decrease the stress on your head or your neck or the situation that you're in. There's always room for improvement. It may never be, like I said, to the level of the teenage, perfect years, but we should be able to gain enough flexibility in the muscle tissue and improve the mobility of the cervical segments, the joint tissue, and teach the muscles through muscular re-education how to hold you more properly to decrease those stresses. So even if it would be, significant joint changes like arthritic changes, we can't reverse arthritis. But what we can do is train the muscles around the arthritic area to do a better job of supporting those tissues so there's less pain caused by stress on those tissues. Does that make sense? Typically, migraine headaches are more neurovascular in nature, so it has to do with changes in the blood flow inside your head. So some of that we're not going to be able to change, but a lot of people who have migraine headaches also have cervicogenic components, so the musculoskeletal components. So let's say you rate your migraine headaches on a 10, on a scale from 0 to 10. If we can eliminate the cervicogenic portion of it and take away part of the problem with physical therapy, we should be able to substantially reduce the amount of pain you have and perhaps make the migraine medication more successful because the cervicogenic component won't be there anymore. So that would be kind of the focus of physical therapy for that. I've had really good success with reducing and eliminating headache. It tends to be a condition that takes more time than most headache patients would like it to take because usually they're not coming to physical therapy until the condition has become quite chronic. They've tried 100 other remedies first and been taking medication for quite a while. And oftentimes we think about in physical therapy, the length of time that a structure or a tissue has been aggravated or under stress sometimes takes that long to backpedal and remove it, but we certainly hope to remove it faster than that. And our bodies are pretty resilient. If we can teach the body how to move correctly and not be in that snowball scenario that I gave you, if we can just take a few of those things out, if we could do the ice and the electric stimulation or things like that to decrease the tissue irritability, and then start with the motor training for the muscles and improving the flexibility and kind of break into that cycle in several different places, we usually see a dramatic decrease in symptoms, especially frequency of symptoms, very early on. And then oftentimes what we're working toward as we're approaching the end is just really the final resolution. But we usually see fast results with reducing symptoms. All right, well, thank you very much for your time.